Good morning, listeners. For people who are tuning in from around the world, it is a rather chilly Friday morning here in Canada. This is Zarbuft Mayo, and I am here with my co-host Brij Karmur at the Brain and Health Talks at SABCR.
Thank you, Zarbuft, for that. So today I just think, we're going to be talking about a really interesting topic because of the irony that's present in the article that we're reading.
So before we actually get into the article, it talks about someone who was affected by brain cancer, and it's a topic that a lot of people have wanted me to talk on, and I've so just to put it on record, it's the reason that SABCR got established in the first place was because a friend of mine who I actually didn't know quite well before, but over the years got to know, and she became very good friends with me. And during our friendship, I realized that she was suffering from brain cancer. So it really didn't make sense to me why someone who's similar to me has the same dreams, the same age as me, goes to the same school, McMaster, lives in the same city, has to face that reality, and this is mine. It doesn't make sense to me, and that was the reason that caused me to go out and establish an organization dedicated to putting an end to brain cancer. And when I say that SABCR is the first of its kind in Canada, it speaks to the lack of awareness around brain cancer. That when I wanted to go out for support, nothing of the sort existed in Hamilton, Burlington, Toronto, Ontario, Canada. It shows that little importance given to this topic of brain cancer because it is the leading cause of solid cancer deaths among young individuals. And Bridge today is going to talk about an article really that beautifully summarizes the journey of somebody who was not only very strong spirited, but also left a beautiful example for anyone who has even survived from brain cancer or is going through the crisis of brain cancer.
That was very touching, Zarbuft, I have to say. But that just goes to show, as you said, the level of in other words, the level of ignorance that we have towards such a topic. I think in today's times, cancer has become so relevant and so widespread that we don't even think about its effects, or don't even think about its relevance in our life, or don't even think about how or in what way we might someday be affected by it. And this is a really good article that we're going to talk about today. It talks about David Servan-Schreiber, the doctor. He was a physician and he was a neuroscientist who had to fight cancer in his life and who died from cancer. And this just goes to show that it's not only anyone, it's not just a certain type of people that are affected by cancer. This guy, he's a neuroscientist, he was a doctor, and he had all the facilities, all the research, all the diagnoses that he himself had done. And all of that information still did not do anything, or still did not play a part in his prevention of cancer.
So, what Dr. Schreiber was talking about is that we all really have the potential of cancer lying dormant in all of us. Each of us also has the body designed to fight the process of tumor development. But he sort of puts on this positive spin while he was facing his reality. And and his book is basically sort of a self-help book to all the Canadians and world in general, all the people in the world who are facing this reality of being diagnosed with a brain cancer. Some of us at a very young age, like my friend, some of them at an even younger age, at like the children at the McMaster Children's Hospital, and some of them at an older age. But the reality faced by them is still horrific and is the same.
Just to pick out a relevant statistic to this talk, if we look at examples such as breast cancer, colon cancer, and prostate cancer, the afflicted percentage in the West are 7 to 60 times more frequent than in Asia. So that just goes to show, even though the West has such a smaller population, we have 7 to 60 times more cases of breast cancer, colon cancer, prostate cancer than in the East, where populations rise as such to, at least 2 billion just in two countries. Also, in Asian countries, the men have just as many precancerous microtumors in their prostates, but in the West, what we have is we don't have a way of preventing these microtumors from developing. But in Asian countries, we see men who have this capacity in their body and the capability to prevent these microtumors to develop into tumors that cause that lead to the death of the patient. So it just goes to show that and Dr. Schreiber beautifully describes this in his book, that something about our way of life weakens our defenses against this disease. And in this article, he shows that he talks about how our body is designed to fight cancer in such to such an extent we don't have to have chemotherapy or radiotherapy to assist us. So I think he really hits hard on the point that we have such a beautiful mechanism in our body to prevent cancer. And if we just apply a couple of things in our life, such as meditation, yoga, a proper diet, that may improve our lifespan even if we are diagnosed with cancer. And just to take an example from his life, he was diagnosed with cancer and was only given up to 6 years maximum to for life to live, basically. But he ended up stretching that out to 19 years, and that's when he actually died. But in those 19 years, he changed his entire lifestyle, and that's what let him live 13 years more than was expected.
So that kind of speaks to how we all live, most of us live with myths that undermine our capacity to fight cancer. For example, many of us are convinced that cancer is primarily linked to our genetic makeup rather than our lifestyle. So you see people exhibiting excessive drinking or smoking or just not taking care of their health. So it is really our lifestyle, that there is genetic predisposition, but the lifestyle can really increase the risk or susceptibility to cancer.
Yeah, that's a really good point that you mentioned, Zarbuft. Even in his book, he has written that genetic factors contribute to at most 15% only of mortalities from cancer. So, in short, there's no genetic fatality, and we can all learn to protect ourselves. So, just to sum up this talk, I guess he really focuses on, this is someone we have to realize as a doctor, as a neuroscientist, someone who are, two different personalities having incredible amount of information, yet he couldn't prevent himself from being diagnosed with cancer. So it can happen to anyone, that's one. And no, the second point is that he went through chemotherapy and radiotherapy. So he thought there was something more that he could do to live longer instead of the 6 years that he was given. So the three were meditation, yoga, and a different diet. It was very natural, right? And it's not any type of conventional drug therapy and whatnot that led him to living 13 years longer than he did. So I guess that just speaks to everyone out there who's diagnosed or not even diagnosed with cancer, that even to prevent, we can still change our lifestyle and incorporate natural things and natural practices that may help in living longer in general.
So I think it would be appropriate to end this talk today with the beautiful quote from his book where he says, "Death is part of life. It happens to everyone. Profit from now, do the important things."
We will see you next week.